So, I am extremely sorry because I'm making all of this video at a time because I have, due to time constraint, I have to make them all at a time. So, today's video is the part 4 of the Casualty series. This is about the lung injuries, acute lung cases, and acute abdominal injuries. This might be a really short and a crisp video, okay? So, first things first, asthma. People come to you with, acute asthma exacerbation or an acute and a chronic exacerbation. Okay, what do you have to do? Okay, we do not administer directly theophylline, which I thought so, but then it's not that. We give out a nebulization. Okay, so what do you do on a nebulization? You have the medicine cup in the nebulizer thing, and then in the medicine cup you fill in 1 bottle of budesonide, that is a corticosteroid, and 2 ml of asthalin, that is a salbutamol. Okay, salbutamol and budesonide. Okay, both of them 2 ml salbutamol and 1 bottle of budesonide. You mix it and then put it in the medicine cup, switch it on, put him on inhalation for 15 minutes, and then he is well and good to go. Send him home. That's it. Okay, and then one other common thing is this shortness of breath. Okay, people there were like, per day I think I used to see around 15 to 20 cases of SOBs on a day-to-day basis. Okay, or whenever the person comes on SOB, always first monitor vitals. After that, what do you have to do? Put on a pulse oxy, check for oxygen stats. Less than 90, put him on oxygen inhalation. Okay, and then suspect COVID. Okay, ask for other symptoms, and then look for cramps. Okay, and then okay, if the person is he doesn't have any symptoms of COVID and all of that, then you would suspect some lung pathology or a heart related problem. And then what you have to do is that you have to shift to acute medical care, and before doing that you have to confirm if you have to send the patient with oxygen cylinder or without an oxygen cylinder. So how do you do that? Okay, you take out the oxygen mask for once the patient is fine, take out the oxygen mask for 15 minutes. If the oxygen stats are maintaining above 92, 93 and all of it, above 90 is the baseline. So if it's above that, you can send the patient without any fear to acute medical care without an oxygen cylinder. In case if the person is, if his stats are dropping below 90, then what you have to do is send the patient, along with the oxygen cylinder, because there are chances that he might collapse in the midway. And then, yes, I've seen case which collapsed that way. So be careful about that. Then you have acute abdominal injuries. Okay, patient usually come in the midnight or early in the morning saying that, my stomach is paining, my chest is paining, I think I have a heart attack, I think I'm gonna die. They come with complaints like that. So what do you have to do? The first and most foremost differentiating feature for the chest pain is acid peptic disease, and the second one is acute angina, as usual. So how do you differentiate that? Okay, first put on the monitor pulse oxy, and then check for his pulse rate, and then immediately secure an IV cannula, and then give him IV Pantoc 40 mg. Then after giving that, just monitor his vitals. So if you see that there is a tachycardia, and then immediately do an ECG. If it is a tachy, something serious to note. Okay, if it is not, then do not worry. Okay, if there's a tachy, and after 10 to 15 minutes, if the person doesn't have any relief, immediately put sublingual GTN and send them to AMC. Get a ECG done, send to AMC. That is it. Okay, if the person actually feels really happy, where I treated like a few cases which were acid peptic disease in fact. Okay, so make sure that you differentiate between APD and angina. Okay, thank you so much for watching.